Calcitriol is a man-made active form of vitamin D. Vitamin D helps control parathyroid hormone and the levels of certain minerals that are needed for building and keeping strong bones. However, some people with kidney disease can't make enough of the active form of vitamin D, so they may need to take calcitriol. This medication is also used to prevent and treat certain types of calcium, phosphorus, and parathyroid problems that can happen with long-term kidney dialysis or hypoparathyroidism. It is usually used along with specific diet recommendations and sometimes other medications. It's important to take the right dosage at the best time to get the most benefits. When taking Rocaltrol, make sure to follow your doctor's instructions carefully. Typically, it is taken by mouth once daily, with or without food. If you're using the liquid form, be sure to measure your dose with a special measuring spoon or device, not a regular household spoon. The dosage will be determined by your medical condition and how you respond to the therapy. Your doctor may start you on a low dose and then gradually adjust it to find the best dose for you. It's important to take the medication regularly at the same time each day to get the most benefit from it. Following the diet recommended by your doctor is crucial to getting the most out of Rocaltrol and to prevent serious side effects. It's also important not to take other supplements or vitamins like calcium or vitamin D unless specifically ordered by your doctor. Some medications, such as bile acid sequestrants, mineral oil, or orlistat, can decrease the absorption of vitamin D. It's best to take these medications at least 2 hours apart from your doses of Rocaltrol, and possibly even longer if possible. Your doctor or pharmacist can help you come up with a good dosing schedule that works with all your medications. When taking Rocaltrol, it's important to be aware of potential side effects. Your doctor may monitor your calcium and phosphate levels and adjust your dosage if necessary. It's important to remember that your doctor has prescribed this medication because the benefits outweigh the potential risks. Many people using this medication do not experience serious side effects, but it's important to be aware of possible symptoms, such as loss of appetite, bone or muscle pain, and changes in heartbeat. If you notice any serious side effects or signs of a serious allergic reaction, seek medical help immediately. It's important to discuss any concerns with your doctor or pharmacist. Before starting to take Rocaltrol, make sure to inform your doctor or pharmacist if you have any allergies to calcitriol or other vitamin D products. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more information. Also, be sure to let your doctor or pharmacist know about your medical history, especially if you have high calcium levels, heart disease, or kidney disease. If you will be having surgery or be immobile for a long period of time, it's important to notify your doctor beforehand, as being immobile for long periods of time can increase the risk of side effects. Unless otherwise directed by your doctor, it's important to drink plenty of fluids while taking Rocaltrol. If you are pregnant, this medication should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, it's unknown if this drug passes into breast milk, so it's important to consult your doctor before breastfeeding if you are taking Rocaltrol. It's important to be aware of potential interactions with other medications when taking Rocaltrol. This includes products such as burosumab, cardiac glycosides, magnesium-containing medications, phosphate binders, and vitamins/nutritional supplements. It's also important to check the labels on all your prescription and non-prescription/herbal products, as they may contain calcium, magnesium, phosphate, and vitamin D. Additionally, it's crucial not to use medications containing other forms of vitamin D while using calcitriol. This medication may also interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you are taking Rocaltrol. As always, it's best to consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Rocaltrol and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. For residents of Canada, contact a provincial poison control center. Symptoms of an overdose may include weakness, headache, loss of appetite, metallic taste, nausea, vomiting, stomach cramps, and dizziness. If you or someone you know is experiencing any of these symptoms after taking Rocaltrol, seek medical assistance right away. Remember, it's important not to share this medication with others. While taking Rocaltrol, you may need to undergo lab tests to monitor your calcium, magnesium, phosphorus, and parathyroid levels. Make sure to attend all your medical and lab appointments. To ensure you're getting enough vitamin D, try incorporating fortified dairy products, eggs, sardines, cod liver oil, chicken livers, and freshwater fish into your diet. Vitamin D can also be obtained from regular sun exposure. Maintaining a well-balanced diet is crucial while taking Rocaltrol. Your doctor may recommend calcium supplements in addition to this medication, with the usual recommendation being 600 to 1,200 mg per day. Always consult your doctor before taking any supplements. If you happen to miss a dose of Rocaltrol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Avoid taking a double dose to make up for the missed one. As for the optimal timing, it's best to take Rocaltrol as prescribed by your doctor, usually once a day. Keep Rocaltrol at room temperature, away from light and moisture. Make sure to store it in a safe place where children and pets cannot reach it. Do not flush Rocaltrol down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, be sure to properly discard it. If you have any questions about how to dispose of Rocaltrol, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.